It is the foundation and the jumping off point for that initiative. It helps with the alignment moving forward.
This is Stepping Up Healthcare. Your host is Tack, and the mission is simple. Build your capability and curiosity to make healthcare better.
Welcome back. It's season 2 of Stepping Up Healthcare. Thanks for tuning in. This season is going to be all about problem solving. We'll do lots of problem solving as this podcast goes on, but this season is particularly laser focused on what is the problem and how do we solve it. So let's get into our first topic of episode 1. Today we're talking about something that sounds really simple, but has a little nuance to it. It's defining the problem. Before you launch a project, collect data, redesign a workflow, implement solutions, you need to be sure you're solving the right problem. So what are we talking about when we say, quote, define the problem? First, let's ask a fundamental question that's going to set the foundation for, honestly, this whole season. What is a problem? Pretty straightforward question, but it can be a little hard to describe. How I describe it to someone I'm working with is a problem is simply the gap between what is expected to happen and what actually happened. So we expected this to happen, but we got that. That's a problem. That gap in between expected versus actual. Quick non-clinical example. I ordered chocolate ice cream and I got vanilla. That's a problem. I expected chocolate, but I got vanilla. So now that we have that shared understanding of what is a problem, it now turns into how do we describe that problem? It's not always going to be as easy as I got the wrong ice cream order. Think about how complex healthcare is. The problems are not always that straightforward, unfortunately. So let's talk about problem statement. A good problem statement helps answer a couple of questions like, what is actually occurring? Where is it occurring? Who is affected? How often does it happen? And why does it matter? Or, as I like to brand that last question, what are the consequences if we don't solve this? Notice what's missing from that list. Solutions. One of the biggest mistakes improvement teams make is jumping straight to solution. You've probably heard statements like, we need more staff, we need new software system, we need more training. Those aren't problem statements. Those are proposed solutions. A problem statement focuses on the issue itself. What is the issue that we actually encountered? Instead of saying, we need more staff in the emergency department, we turn to, patients in the emergency department are waiting an average of 90 minutes before they see a provider, resulting in increased patient dissatisfaction and a higher number of patients leaving without being seen. Now, we have something we can investigate, and you haven't unknowingly introduced your bias into the problem. A well-defined problem creates clarity and alignment. Everyone understands what needs attention before debating how to fix it.
Why does it matter?
Improvement projects and initiatives require time, energy, meetings, data collection, and often significant organizational resources. It's 100% worth it, but when the problem isn't clearly defined, teams can spend days, weeks, even months, even years solving the wrong issue. Think about a patient who comes into the hospital with chest pain. Healthcare professionals don't immediately start performing surgery. They assess, diagnose, and then determine the root cause before deciding on a treatment plan. Process improvement should work the exact same. If we rush to solutions before understanding the problem, we risk a lot. Wasting resources, frustrating staff, creating unintended consequences, and failing to improve outcomes. A poorly defined problem can also create disagreement. When team members have different interpretations of what's wrong, they naturally propose different solutions. This is also where frustration comes in. Generically, and maybe a little dramatically, if two people are solving two different problems, they're going to start getting agitated with each other. It may be very obvious what the solution is to one person, while the other person is solving a completely different problem and coming up with solutions that just don't make sense. A clear problem statement helps everyone start from the same place. It is the foundation and the jumping off point for that initiative. It helps with the alignment moving forward. In many improvement projects, spending more time defining the problem actually shortens the overall project timeline because the team avoids unnecessary detours later and the scope of the work is defined. This also helps with reducing what a project manager would call scope creep. Scope creep is when the scope of a project ends up expanding and then expanding to include more and more. Some of it might be warranted, but that is a discussion to be had and aligned on. An exaggerated example of scope creep is, say we want to reduce check-in times by 2 minutes. Sounds like a worthwhile project. Very manageable. So we say, let's work on improving front desk workflow. Excellent. Yes, that has a very strong connection to reducing that 2 minutes. But then we say, well, we should also add in room turnover process. But then what about redesigning the appointment scheduling process? Well, looking at a new electronic medical record might be warranted too, so we can actually accommodate the process changes mentioned previously. Well, why don't we rebuild the whole healthcare system? And on and on. The project charter says reduce check-in time by 2 minutes. But now we're set on transforming healthcare delivery across North America. Sure, all of that might need to be done, but what are we truly working on? What is the problem we're trying to solve? And what is in our control?
Let's talk about some real-world examples.
Let's talk about patient falls. An organization notices an increase in patient falls. The initial reaction might be, staff need more fall prevention training. Sure, that might be warranted. But after defining the problem and reviewing the data, the team discovers most falls occur during shift changes when patients attempt to use the bathroom without assistance. The problem wasn't primarily a training issue. The actual problem involved communication and coverage during handoffs. A completely different solution emerges. An example with long clinic wait times. A clinic receives complaints about long wait times. Leadership initially believes providers are running behind schedule. After reviewing and possibly mapping out the patient journey, they discover the biggest bottleneck occurs during registration because insurance verification is being performed manually by calling the insurance company. The hold time for the insurance companies is what's taking a long time. That's the issue we should be tackling. The problem wasn't provider productivity. It was a front-end workflow issue. In this theoretical example, maybe it's easier and faster to use the online portal. So then that's our test of change. So say you're starting an improvement project. How do we actually create a strong problem statement? Whether it's for a charter or maybe you're starting an A3. Identifying the actual problem is extremely important. But how do we communicate it and scope that problem? There are a couple different ways to do this, and I'm going to go over a handful of them. This isn't a comprehensive list by any means, but just a couple of suggestions. The first is current state versus desired state. So ask yourself, what is happening now, and what should be happening? Remember back to the beginning of the episode where we were talking about the gap in between expected and actual. So it's about documenting that gap between what we expected to happen and what actually happened. For example, current state. Patients wait an average of 30 minutes past their appointment time. Desired state. Patients wait no more than 5 minutes past their appointment time. The gap between those two, the 30 minutes versus the 5 minutes, becomes the focus of improvement. Second method, problem statement formula. Simple formula many improvement teams use, including myself from time to time, is using this statement. I'll go through it a couple times here. The problem is blank, occurring in blank, affecting blank, resulting in blank. Once again, the problem is, insert your issue here, occurring in whatever location it's happening, affecting whoever it's affecting, these people, resulting in this impact. So an actual example of this all together is, the problem is delay in patients being discharged, occurring on inpatient units, affecting nurses, physicians, and patients, resulting in reduced bed availability. Simple, fairly clear, pretty focused. No solutions in that problem statement. Lastly, method 3, the 5W approach. This is my preference. We call it something different at the place I work, but it's very, very similar. This method involves asking 5 questions. What is happening? Where is it happening? When is it happening? Who is affected? And why does it matter? Or what is the consequence? Now that you've answered these 5 questions, you could put it into a problem statement, make it a couple of sentences. Oftentimes, I just leave it as answering those questions. So, what is happening? Where is it happening? When is it happening? Who is affected? And what is the consequence? And just leave it at that. Most importantly, these questions force clarity and often uncover missing information. If you can't answer these questions, you probably don't understand the problem well enough yet. I do want to focus on that last question just for a moment. The why does it matter, or what is the consequence? This question can be a little more subtle than you think. It's answering multiple things. Number 1, it justifies why the problem deserves attention, time, and resources. If we're going to commit to solving this problem and give it that time, attention, and resources it deserves, putting the why behind we are doing it is important. Number 2, it creates urgency and motivates action. In other words, it lights a fire under those who are involved in this project. And number 3, the last one, it adds a human component and helps keep the focus on the team members rather than just metrics and processes. Hopefully, this leads to engagement and buy-in as well. It also helps lock in the empathy by highlighting the frustrations and challenges affecting real people, aka our staff.
Homework time.
All right, first homework of season 2. So before our next episode, I'd like you to practice defining a problem in your own work area. So that has 2 parts to it. A, finding a problem. So what did we expect? What actually happened? That gap in between. Defining what your problem is. And then number 2, actually making a problem statement from it. Maybe it's delays, rework, communication, breakdowns, documentation issues, scheduling challenges. Then write a 1-sentence problem statement. Use one of the methods we discussed today. Ask yourself, am I describing the problem or a solution? Is it specific or vague? Who is affected by this? And what impact does it have? Or what is the consequence if we don't solve this? Once you've written your problem statement, share it with a colleague. If they understand the issue without too much extra explanation, you're probably on the right track. A few thoughtful questions are always welcome around it, just for clarification. Remember, this isn't just about fixing things quickly. It's about understanding what's actually happening before deciding what we do about it. Sometimes we do have to go slow to go fast. Well, that's all I've got for you today. The next 2 episodes are going to be about PDSA. We're going to do the first episode on plan and do, and then the second episode about study and act. A little self-promotion before the sign-off today. If you haven't checked out my YouTube channel, make sure to do that, at Stepping Up Healthcare. I've got all the podcast episodes uploaded there, but also have some exclusive only to YouTube content, so check that out. Until then, I'm Tack. You're appreciated. Let's step up healthcare. Now, once you've answered these 5 questions,
he asks each traveler 5 questions. 3 questions. 3 questions.